So many people come into the clinic asking about the middle area and the tummy area as to what can they do or what do they need. And it's a hard question sometimes to answer. Is it a tummy tuck? Is it liposuction? Or maybe is it actually both? First thing I always want to say to patients is this is not a replacement for good health and exercise. Surgery is an addition to you working hard and getting in the best shape you can get in. Once you're in the best shape that you can be in, your operation is safer, better, longer lasting, and will give you the results that you're really looking for. So how do we decide between a tummy tuck and liposuction? Well, we've got to look at what makes up the tummy. We have skin, we have fatty tissue, and underneath that we have the muscle layer. And underneath that we have the bowels, the stomach, the uterus. Now remember, I can't touch any of that last layer. And there is some fat around there as well. And the only thing that reduces that intra-abdominal fat is working out and losing weight. So now we have to look at those other three layers. First, we look at skin. What is your skin tone and texture like? Do you have a lot of stretch marks? Have you lost a lot of elasticity of your skin? Or do you have good tone and texture? Do you have a lot of skin? Well, any of us who've had children know what I'm talking about here. That looseness of the skin, it doesn't have good elasticity and it's hanging down. Well, liposuction alone in that situation probably won't help. We need to do something to deal with the amount of skin that we've got there. Then we look at the amount of fatty tissue that's there. If you have good skin tone, some fatty tissue, especially if it's in sort of areas or pockets, then maybe you're a candidate for something less aggressive like liposuction, or maybe even less aggressive like some of our non-surgical options for fat reduction like Zeltiq and Liposonics. The third thing we're going to look at is that muscle layer. If that muscle layer has been damaged either with pregnancy, weight changes, really there is nothing that will tighten that muscle or move that muscle over other than a surgical procedure like a tummy tuck. So first we look at your tummy. I like to look at the tummy standing. Everyone looks pretty good standing. Sitting, everybody hates sitting. And lying down, which is pretty well our best position. So we're going to look at those three areas and see those three components, skin, fat, and muscle, and make a decision about each one of those areas on how we're going to deal with that. So now we've had a look at your tummy and we've decided that you have good skin tone. You don't have too much extra skin, but that layer between the muscle and the skin is a little bit thicker. So I always say with liposuction, what you pinch between your fingers is two layers of skin and the fatty layer in between. And with liposuction, we're going to take down that fatty layer. Remembering, I'm not going to remove skin. Remembering, I'm not going to change muscle. So if we look, let's say you have a little bit of a muscle bulge in your lower belly. Well, this is our muscle layer. That's not going to change with liposuction. Here is our skin layer, and this is the layer in between. That is our fatty layer. And when we do liposuction, we're not going to change that muscle, but we will make this distance smaller. So you're going to look better, you're going to have a better shape, but be realistic of what it can and cannot do. Now, I always say the skin doesn't change, and that might be a little bit of a misnomer. When we do liposuction and we're removing this fatty layer in between, what happens is the skin does tighten, because as wounds heal, they do tighten. And any woman who's had a child can tell you, we deliver these beautiful children. I delivered a couple of these 9-pound children. And 6 months I looked down and my skin was still pretty loose. I was calling all my friends going, somebody's going to do a tummy tuck. And at a year, I had to admit the skin had tightened significantly. So that skin tightening takes 1 year to see the final result. So wait, you'll see the contour change right away, but you won't see the final result of what you're going to get till about a year. When we talk about liposuction, we do talk a lot about the tummy, but it can be used in many other areas. Thighs, well, we all are either one of two fruits. We're either apples or we're pears. So either you need a little bit here or a little bit in here. We can also treat the arm areas. We also treat the neck, which is a great, easy, small thing that makes a really, really big change. We've been talking a lot about liposuction for women after having children, But don't forget that liposuction also is the most common surgical procedure that we do perform on men, particularly in the midsection, the tire area, and also in the chest wall, or what's called gynecomastia, breast tissue development. One of the major advantages of liposuction over other procedures is how small the scars are and how well they can be hidden. Usually when we're doing the back area, a scar can be in the bra line, in the buttock crease, and 2 smaller scars in the anterior abdomen. They look just like somebody took a mole off, so you don't have to answer any embarrassing questions as to what was that from, what was that surgery? So liposuction is an excellent treatment modality with definitive results and minimal scarring. We have to pick what is the right operation for you at any given time. So come on in for a consultation and we'll see what we can do for you.